Committee on Health Services. We do have a quorum, so we'll start with roll call, please.
Senator Rocky Adams. Senator Chambers Armstrong.
Here.
Senator Berg. Senator Carroll.
Here.
Senator Douglas.
Present.
Senator Elkins.
Here.
Senator Funky Fromeyer.
Present.
Senator Nemes.
Present.
Senator Tishner. Senator Wise. Representative Bentley. Representative Bratchard.
Present.
Representative Bray. Representative Burke.
Here.
Representative Callaway.
Present.
Representative Dotson. Representative Duvall. Representative Frazier Gordon.
Yes.
Representative Justice. Representative Neighbors. Representative Palumbo.
Here.
Representative Raymer.
Here.
Representative Riley. Representative Rourke.
Here.
Sorry.
Here.
Representative Sharp.
Present.
Representative Weber.
Present.
Representative Wilner. Representative Witten.
Here.
Co-Chair Mosier. Co-Chair Meredith.
Present. Again, we do have a quorum and duly constituted business here. I would ask to make sure that you've got your phones on silent if you haven't done that already, so we can keep this meeting running as smoothly as possible. You see, we have a very full agenda today, and we'd ask our presenters please be as concise as you can possibly be. Immediately following this meeting, we have Veterans, Military Affairs, and Public Protection Committee meeting that'll be next door. Several members of this committee are on that, so we want to make sure we finish in plenty of time. With that, our first, before I do that, let me recognize a couple of new members, and that's Senator Greg Elkins. Senator, glad to have you with us. And not new to the legislature, but new to this committee is Representative Ruth Ann Palumbo. Glad to have you both this morning. And obviously, Representative Palumbo is replacing the late Representative Blayman Swan, who passed away. We could just have a moment of silence in memory of him, if you would, please. Thank you. Our prayers are certainly with his family. Our first order of business is the ending the federal COVID-19 public health emergency. If our presenters are here, I'd ask you to come forward. I think if everyone's familiar with this agenda, you'll see this whole meeting is kind of focused upon what's happening post-COVID.
Good morning. I'm Eric Friedlander, Secretary of the Cabinet for Health and Family Services.
Good morning.
You need to turn it on.
My husband would love one of those buttons at home. I'm Connie White. I'm the Deputy Commissioner for Clinical Affairs for the Kentucky Department for Public Health.
Glad you have you both with us this morning. If you would, then please proceed.
Thank you very much. Before we begin this presentation, there are a couple of things I'd like to talk about, two pieces of good news and one piece of bad news. First is we have selected the new commissioner for the Department of Community-Based Services. Acting Commissioner Lisa Dennis has been promoted to be the commissioner. Lisa, many of you know her. She's testified numerous times in front of different committees. She brings a wealth of experience, lived experience. She has actually had positions and grown up and come through the Department for Community-Based Services all the way from the local level to the regional level to the state level. I'm very excited that she's agreed to be the commissioner, and hopefully she will bring some real implementation to some of the things we've been talking about, some of the new things we've been doing, and I believe that she'll bring a stability to the Department of Community-Based Services that will be very helpful to the department. Secondly, the Department for Behavioral Health, Developmental, and Intellectual Disabilities, and yes, that's one of the longest names in state government, and it's my fault because I named it when I was there. Dr. Katie Marks, who has been leading Kentucky's core effort, the opioid effort on reduction, actually began under the Bevan administration, and she is agreed to be the Commissioner of Behavioral Health. She will bring, I believe, change to the department, a new perspective to the department. Her experience is in substance use. She also has a background in behavioral health and will be learning parts of the developmental and intellectual disability world, which I'm very excited for her to be there. She brings an energy that I think, again, some of you have seen her testify, and I believe a level of competence has me very excited that she will be joining us. But that leads to the bad news, which is in the field of folks with developmental and intellectual disabilities, our home and community-based waiver slots are now full. First time ever for all of our waivers to be full. I think there are 2 tiny waivers, acquired brain injury and Model 2 waivers that don't have waiting lists, but everything else does, including what is primarily the long-term care waiver. It's called home and community-based waiver. There are over 17,000 slots. For the first time ever, those slots are full. In August, we begin a new waiver year, and it's a lot of federal jargon, but we'll have some slots open up, but it'll be a brief period of time. We'll be coming to the General Assembly during the next budget session, I'm sure, and requesting more slots. It's how these the slots are allocated each year and in the budget each year. And so we will be asking for more slots for more folks. This waiver in particular, and what we, I think, have to address, and I'd be happy to address this in a full committee hearing, but I just wanted to let you all know some of the challenges we have around children. And we've had some of our first public kind of forums on a children's waiver. And these are all really, really complex issues, and I'm sure we could have an entire meeting or 2 or 3 on waivers alone. So I wanted to put that out there for everybody to know. I'm really excited about the new commissioners. I think having that leadership in place will be very helpful, particularly heading through some challenging times, which we all know we're going to have. So thank you for that, Chairman Meredith. I did want to let folks know that up front.
Thank you, appreciate that. And just to follow up your conversations about the waivers, I think certainly that does warrant a separate, probably full meeting on this. Still working with Representative Moser to develop our agendas for the balance of this year, but certainly the waiver programs are very important to us and something that all of us have a lot of interest in. So we will commit some time to that in the future, I'm sure, but I appreciate that.
Yeah, and I'm available anytime folks would like to come, or if they like individual meetings, I'm happy to do that as well, as always, as you know.
Thank you.
And with that, I'm going to turn it over to Dr. White.
Good morning, everyone. Thank you for asking me to come today. Dr. Stack had a family obligation, and so he asked me to come in his place. One of my joys of the job that I do have is I get to fill in for the commissioner whenever that happens. And I'm happy to talk to you today about what's happening in public health with the ending of the national public health emergency. So our federal emergency, as you know, the emergency ended in May, and our federal grants are starting to run their course. We have some that are ending at the end of this month. We do have in disaster response, health equity, and laboratory. Some of them have been extended another year, so they will end in June of 2024. But most of that extra COVID funding that's been coming our way as a department will end the end of this month. We, as you know, have done testing support across the state for the last several years, and now that support is really honed in on our long-term care facilities, about 300 of those in the state. Because of the particular vulnerability of that population, we want to assist those long-term care facilities in their ability to do testing. And so you'll see, as you've seen, public testing, those kinds of things have wound down as that funding has gone away. Our antigen test support is also starting to wind down. We will continue. We have worked in the past with K through 12. I've been very involved in the Kentucky Department of Education testing and making sure schools that were interested in having that testing is available. We've offered that through summer school this year. Some have taken it, some have not been interested, but we've done testing starting there. We have worked a great deal in our homeless shelters to be sure they have testing available, and we've worked very closely with corrections to be sure that testing is available. That's all winding down. So now we're going to be able to give our testing resources to our local health departments so they can choose how in their communities is the best way to use those testing, and continue with our homeless shelters and with corrections. So that's a relationship we had started building right before COVID started, and that relationship with public health and Department of Education is stronger than that has ever been. Most of the responsibilities for vaccines and treatment is going to transition to the public marketplace. As you're going to see, this is going to be an infectious disease that we will.
The public regular commercial side on vaccines, on testing, on reporting. It's just an affirmation that we're headed
in another committee. What have we learned? That's something I think public health is very good at, is stepping back from a situation, and we call it hot washes or after action look backs. What did we learn? What did we do well? And how do we want to improve? One of the good things that has happened, and I've been involved with this, I've been around for a while, not as long as the secretary, but I've been around for a while, and we've been working for years trying to get laboratories, the respiratory illness team or the respiratory disease team. And that team of epidemiologists and staff will be focusing on looking at things like COVID, like influenza. Influenza has been a problem in the past. So looking at influenza, looking at RSV. RSV is not a reportable disease, but we do have ways that we can get that data. There's a new vaccine for that coming out relatively soon. The last professional meeting I was at, there were banners everywhere about the RSV vaccine. So that's very exciting. So we've got a group that will be focusing their energies on respiratory diseases that is just now starting up. As I said, I've been around for a long time. I started with the Department for Public Health and Women's Health in 2009. So I've seen a lot of commissioners come and go, and a lot of health department directors come and go. And I do agree that I think our relationship as a unit is better than it's ever been in my time here. Local public health departments had we've heightened the perception of the local health department, and I think now we have, as Dr. Stack said before, we've got 61. We have a health department, a brick and mortar in every county in Kentucky, all 120 counties, but they're divided into 61 health departments. Several counties are grouped together in a district. So we have 61 health department directors, and we truly see them as the chief health strategist in their community. And that relationship has been quite stellar, and we are moving together, because prevent, promote, and protect, that's not just the Department for Public Health's vision, but that is Kentucky public health. All the aspects of Kentucky health in the state see prevention, promoting, and preventing and protecting is our mission. We have done some structural realignment of regional teams. So we have our structure at the state, but we have regional folks, and we've always had this, but we've been able to really enhance those relationships. So there is someone regionally that's looking at preparedness in a particular clump of counties, pulling together the hospitals and the healthcare providers and the dialysis centers and the dentists and all of the people that provide health care in those regions. So when there is a snowstorm, and we need to call because we need the local government to plow the road to get to the dialysis person that needs that. All of those things that most people don't think about. Some of the things that we do. That cooperation and camaraderie has already been built, and we're continuing to build on that. So with preparedness and our immunization and all of those other things listed on the slide, we were very excited. We just got a new grant for Medical Reserve Corps. I remember when I was in medical practice here in Frankfort, I was part of the Medical Reserve Corps, and that kind of petered out because there wasn't funding to have somebody really champion that, and we've got some new funding. So we're really going to work hard with our local providers to be sure that they know In case of emergency, that's not when you have a training. In case of emergency, that's when you call and say, remember those desktop trainings that we did? Well, it's time to kick that into gear because we need you. Workforce development has been extremely exciting. We are not only looking at building and bringing in, we had all of these folks that were working with us on COVID, and we've been able to kind of go to them and say, we have open positions because we've seen how you work. We know your work ethic. We know your abilities, and we want you to stay on, and we have positions for you. So not only are we trying to fill empty positions, but we're also trying to develop our workforce of the people that are already there, providing them with training opportunities. As simple as we've had several Excel spreadsheet is not my strength, but people to learn, how can you take an Excel spreadsheet and let it work for you? How can you use Word to work for you? Tools they use every day that they use maybe just on the surface, but how can you take that tool and make your job easier and more efficient? How can we give you more opportunities to get certificates at local universities, different training?